My route, my journey to becoming a board-certified plastic surgeon is a little different. I really went into medical school with a headset that I was going to become a pediatrician. And interestingly, as I went through my first 2 years of medical school and had my first exposure in New York City to pediatrics, I was wildly disappointed, mainly because I was in a very kind of a highfalutin medical center where only the professors were allowed to, only the mothers would allow the professors to see their children in the pediatric clinic. So I really didn't have that hands-on experience, and it really disappointed me. But there was one little boy on our service at New York Hospital, Cornell Medical Center, that was actually a child from Colombia, South America, and he was on a special program who had come up because he had a cardiac defect. So he came up really without family, all on a charity basis to our hospital, and he was going to have heart surgery by our very prominent heart surgeons at New York Hospital. He was on our pediatric service. I had a chance to be his doctor, if you will, a student doctor, because he really wasn't assigned one of the luminaries, though he had great care all around him. And I got a chance to go to the operating room to watch his heart surgery. In fact, they even gave me a retractor to hold, and the whole thing was a new exposure for me. So it completely changed my perspective on caring for children and gave me a surgical slant. So at that point, I thought, well, I'm going to be a pediatric cardiac surgeon. From there, I went on. I finished medical school. I decided I needed a full training in general surgery to get into cardiac. Did that at UCLA, a 7-year program, which included 2 years of cardiac surgery research, which also got my excitement going for the nature of cardiac surgery. But interestingly, during those 2 years, I had a lot of focus on the fine-tuned surgery of cardiac surgery, transplanting veins to create arteries to replenish the blood supply in the heart. And it was really then when I realized that I wasn't sure that I wanted to devote my career to basically at that time in the 80s, patching up hearts of generally older people that had a sort of a life of not taking care of themselves, really kind of buying time for them, as opposed to my fascination with, again, children and that fine-tuned surgery. So when I finished general surgery, I decided to go into plastic surgery with the express intent to becoming a microsurgeon. And in this way, being able to work on all sorts of problems in a very positive, reconstructive light, and people of all ages, particularly children. So that's really how I became a plastic surgeon, was via pediatrics, then cardiac surgery, and then finally microsurgery, plastic surgery.